Yes. Good morning and welcome. I will call the Board of Health meeting of August 27th, 2021 to order. And on the agenda is, we have an executive session to evaluate the qualifications of an applicant for public employment for RCW 43.30.110 LG health officer candidate. And we will be in executive session for up to 45 minutes.
You leaving?
What's that?
You
Yeah.
leaving?
Yep,
Yeah.
going next door.
Leaving.
Foundation, they all have Bluetooth walk.
All right, we are back in session and apologize for the false alarm. We actually have some public comments this morning. We're going to hear those before we go into executive. So please stand and address the board.
Spot.
Or fine.
Okay.
Get a microphone?
Oh, my name is Nancy Lust and I am the chair of Friends of Rocky Top. I am here for a number of reasons. One is I wanted to thank Commissioner Curtis for getting back to me regarding where you are in terms of getting some sort of protocol on fining for solid waste handlers. And Commissioner Curtis had sent me an email that Shawn wrote back to him. So Shawn, I have that email right here regarding the it just says the health district does not have a schedule of fines or penalties that it may issue to non-compliant businesses or individuals. We do have established hourly rates that vary by program that we will invoice for once our services go beyond what the original fee for service covers. In the case of House Bill 1154, it may give us the authority to issue the fines that are described therein. However, the process for the health district to carry out the issuance and collection of those fines has not been established. I would encourage you to keep moving forward on getting that established. Typically, this would go through the local prosecutor's office, but the health district does not have direct access to the prosecuting attorney to represent us. To me, that's a bit of a problem that I hope you can figure out a way to work around. Therefore, I believe we would need our current legal counsel to advise us on how this process would work for the health district. Whether it would be seeking those actions through a court decision or working with the appropriate prosecutor's office to represent the health district in issuing and or collecting on fines and penalties. And I don't think there's anything in the language of the bill that requires court action. I can see the need to have all your ducks in a row before you issue the fine to protect yourself. And so I encourage you to do that. But I would like to take issue. On August 10th, we have one of our board members has bought a drone, Paul Herkey. And he has an orchard next to the Rocky Top landfill. And so he goes out periodically and takes pictures. And then he drops the disc in my mailbox. And I upload the stuff and put it on a Google Drive. I've given Stephen Newchurch access to this. And I go through them and I send emails to the regulators saying, this is what we're seeing. And on August 10th, I sent in an email with photos of tired mattresses that were in the landfill that shouldn't have been, and new waste. When they've been told not to accept new waste, it was clearly in the landfill. August 12th, I sent more photos of tires in the landfill. August 26th, I sent more photos of tires and mattresses in the landfill. And I spoke with Stephen Newchurch, and he basically said, well, our attorney isn't sure whether or not we can use your photos as evidence. And that just made my jaw drop, because we're dealing with a company that has slow walked, it has not been truthful, and it has violated its permit in so many ways. And when DTG says to Stephen, we're not accepting new waste, they believe that, apparently. We provide evidence that they're accepting new waste, that there's tires in the landfill, there's mattresses in the landfill. Mattresses, we now know, are part of the problem with all those fires. And we've never been untruthful to the health district. Every piece of evidence we provided because we care. And we're providing it because the system is set up so that you rely on the public to complain. You don't know what's going on out there. The neighbors do. And so when we complain, the system is someone comes out and investigates. But when you've got a tire in the landfill, it gets covered up within 24 hours. And if you don't come out that day at that time, you're not going to see it. And so I think there needs to be a way to accept these photos as evidence. And if that way means that you need to hire me, I'd be happy to work out a contract where I could be a subcontractor for the health district. So would Paul, I am sure. Or maybe you figure out a way to get DTG to hire a spotter so that they've got somebody looking at everything that comes out of those trucks. I don't know. Maybe you hire someone else who works out there full-time, because they need somebody out there full-time, because there's all kinds of shenanigans that are going on. And so, I mean, I've had conversations with Tommy Carroll at the county, because he never goes out there, ever. And he doesn't have any budget for code enforcement to go out there. And he made the comment one time when I was talking to him, he said, geez, I wish I had a drone. So I emailed him and I said, what kind of drone would you like? Maybe we'll see about getting a grant for a drone. I never heard back from him. And the reason I never heard back from him is because he doesn't have time. He doesn't have a person to go out and use the drone. So what I'm telling you is if you're gonna have a system that is reliant on the public to complain, you need to trust the public and trust their evidence. Or pay more to do the regulating and the inspecting.
So Ms. Les, we greatly appreciate everything you came to share this morning. You do have a time on
I know I was a little long-winded and I appreciate your time. Thank you.
Wonderful.
Just introducing myself again, Dr. Maxwell, Jennifer Maxwell, family physician and co-chair of the Public Health Committee for the Washington County Family Physicians. Thank you.
Thank you, Dr. Maxwell. Right, then the public comment is over. We are going to adjourn for executive session for up to 45 minutes. Thank you. All right, welcome back, everyone. We're going to return to the agenda. Item 3, which is introduction of guest staff. Do we have any today? Oh, we have a guest, but do we have any staff?
We have one staff member, Kate, who's the environmental manager, but she's here because we met her before, but she's going to be presenting Spotlight.
Thank you. Then we move on to consent agenda. All items listed with an asterisk are considered routine by health board and will be enacted by one motion. There will be no separate discussion of these items unless a board member requests, in which event the item will be removed from the consent agenda and considered in its normal sequence of the agenda. Does anyone on the board wish to remove an item from the consent agenda? Seeing none, no, I'm sorry.
I was just gonna move to approve the consent agenda.
We have to have a read first.
Okay, I'll wait.
Hold on,
All right.
would you
All right.
read the agenda, please?
July 25th, 2025, Yakima Health District Board of Health meeting minutes. Payment on accounts payable and payroll issued in July 2025 in the amount of $1,096,692.
Thank you.
I'll move to approve the consent agenda as just read.
I'll second.
So we have a motion and a second to approve the consent agenda as read. All of those in favor, please say aye.
Aye.
All right, thank you. We heard you, Alicia. Any opposed? All right, then the ayes have it. Motion is passed. Thank you. So now we have our Yakima Health District Spotlight, a shellfish safety by Kate Orchestra. Did I get that right?
Yeah.
Thank you. Take it away, Kate.
Thank you. So, this month's spotlight, we will be discussing shellfish safety. This is a topical issue every summer. We see outbreaks related to shellfish across the country and in Washington state. And so we wanted to share just a little bit about what we do at the Yakima Health District to ensure that our constituents are protected from risks associated with consuming shellfish. So today we'll be talking about what we consider shellfish under the food code, the risks associated with those products, and how we have protections and requirements in place to address those risks. So under the food code, so there are two broad categories of shellfish, which are crustacean shellfish and molluscan shellfish. Under the Washington State Food Code and the FDA Model Food Code, the only ones that are counted as shellfish are those molluscan shellfish. So lobsters, crabs, shrimp, prawns, and crawfish are not considered shellfish under the food code. From the shellfish category, that includes oysters, mussels, scallops, and clams, any of the hinged or bivalve mollusks. Those can be fresh or frozen, cooked, raw, shucked, or in shell. And from that, there's a subset of live in-shell shellfish that we refer to as shell stock when they're still living. So there are certain risks associated with these products. The reason that they have inherent risks is that they are filter feeders. So shellfish feed by filtering in dirty water that has contaminants and nutrients and outputting clean water and waste product. That can cause pathogens and other contaminants to accumulate within the tissues of the shellfish. And these pose inherent risks as contaminants and pathogens can directly impact human health, especially for people who are immunocompromised. There are a few different things that can impact whether or not shellfish are contaminated. That includes runoff, whether that's from sewage, from fertilizers and agricultural products, or chemical runoff from industrial facilities. If the water is warm, that prompts the bacterial growth and can increase the rate at which bacteria reproduce within the water and within the oysters or other shellfish. And also if there are any algae blooms in the area, those can produce marine biotoxins which accumulate in the shellfish. This can cause a variety of different illnesses. The most common that we see are Vibrio and norovirus, which both primarily produce gastrointestinal effects. Other illnesses can include hepatitis A and listeria, depending on what pathogens or contaminants are getting into the water. There are also a few different classifications of shellfish poisoning that are caused by those marine biotoxins produced by harmful algae species. And those can cause effects to the central nervous system, including paralysis, amnesia, and other neurotoxic effects. Every year we see a lot of outbreaks of Vibrio across the country and in Washington state. So this year, there's a very notable outbreak in North Carolina in the Outer Banks region. They've had 59 cases so far this year and 1 death. In Florida and Louisiana along the Gulf Coast, they tend to see a Vibrio every year. And this year they've each had about 20 cases and 5 deaths. In Washington state, we've seen 28 cases so far this year, with 3 of those cases in Yakima County. Last year, we also had a very notable outbreak of pyramidal shellfish poisoning, which again is caused by those marine biotoxins produced by algae. Last year, between Oregon and Washington, we saw an outbreak that had 42 cases with 7 people hospitalized and 1 person placed on a ventilator. So shellfish do have inherent risks, but we do have protections under the code that our staff go out into food establishments and ensure that shellfish are being properly maintained. So the first thing that we look at with live shell stock specifically is looking at the way that they're stored. So since these are still a live product, they do require airflow, they require oxygen, they do breathe. And so if they're submerged in water, they pose the potential of drowning, and that can cause decay of the tissues and more rapid pathogen accumulation within the tissue. So when they are submerged, since they are filter feeders, that also provides an opportunity for them to exchange contaminants and pathogens. So if we started with only 1 or 2 oysters that were contaminated with Vibrio, and then they were all submerged together, we could end up with that whole batch being contaminated. So this photo shows an excellent example of what we would be looking for. Each harvest batch is separated into a different row. They all have their harvest tags in the back. They've got excellent drainage, and so that's just a perfect example of shellfish storage that we would be looking at in the field. We also assess the condition of live shell stock, ensuring that they're still alive and in good condition. So some of the things that we look for are broken shells. We want to make sure that if there are any open shellfish, that when their shells are tapped, that they do close. If they are dead, they should not be sold, since dead shellfish can rapidly accumulate pathogens. They no longer have a functioning immune system, and so there's just a more rapid growth of pathogens within the shellfish themselves. When we have shellfish products that are already shucked, so when you can go to the store and buy a bucket or a can jar of oysters that are already shucked, those are packaged in a brine that reduces the rate of pathogen growth, and so that's a secondary protection that's in place. One of the most important things that we look at during our inspections, and one of the most important protections that we have for public health, are the source requirements for shellfish. So shellfish need to come from a certified harvester if they're produced in state, or a certified shipper if they were grown out of state, which means that if you go out on the beach and you're harvesting oysters, you can't take them to the clam chowder place and ask if they want to buy them. They will say no. So live shell stock come with harvest tags like the ones shown in this photo, and those have the harvester information, the harvest area, the date of harvest, how many were harvested, and then the food establishment, the restaurant or grocery store is responsible for putting the dates of service on those tags, so labeling when they started selling them and when they stopped selling them. And other shellfish products have that information on their label as well. So when we do have shellfish related illnesses, if someone were to call us and say, hey, I ate oysters at this restaurant on July 18th and I got diagnosed with Vibrio, we would be able to reach out to that restaurant directly and say, okay, send us all of the shellfish tags that you have for shellfish that you served on July 18th. And we would be able to get that information and share it with the State Department of Health. And they work with the State Department of Fish and Wildlife to determine if there need to be any shellfish harvest area closures or advisories. So this image is a screenshot of the map from Washington Fish and Wildlife, and it shows which areas are currently okay to harvest shellfish in, which ones have advisories, and which ones are closed for harvest. And all of that information comes from local health departments and other organizations that report illness associated with those, as well as water quality monitoring and shellfish monitoring at those sites. So all of this work plays into our delivery of our mandated services. We are the authority having jurisdiction for conducting routine food inspections of restaurants and food establishments. It also supports us in developing a network of partners invested in improving public health with our work through the Washington State Department of Fish and Wildlife and with our operators of food establishments. And this also helps us to increase the effectiveness and efficiency of our goals. By having these robust traceback systems in place, it saves us a lot of time and effort when we do have an outbreak. We're able to stop it at the source and prevent further illnesses. So with that, does anybody have any questions?
A comment and a question.
Yes.
This is why I don't eat oysters. Question. So a lot of times I see the trucks by the side of the road who are selling oysters. Do they have those same tags? Do they?
Yes, yeah, so when you purchase oysters, you don't typically receive a copy of that tag. That's something that's retained by the establishment.
If you can ask to see it?
Yes, yeah, and so that's something, when we did have those 3 cases of Vibrio, our communicable disease team alerted us to those, and so we reached out to all of the establishments associated, and they were able to provide the shellfish tags. And so even if it's one of the shellfish sales trucks versus a grocery store or restaurant, all of them have the same requirements.
Thank you.
If you buy from like Native American sales, are they monitored in the same way?
So those would be through the IHS inspections, and I'm not entirely familiar with all of their requirements. I'm not sure if you know.
Travel public health versus IHS.
Okay.
Catherine, I don't know if you know if those are inspected.
We can check. There definitely is an inspection process for restaurants, but I don't know.
I just want to know Washington State
That's not that
jurisdiction
way.
over it, yeah.
No,
We
that's
have a
top-
river, they have, the shelters, we have that, so.
I believe they would be.
And I would share also to your point about the trucks, there are a lot of oyster trucks specifically. A truck in a gravel parking lot may not appear to be highly regulated, but it actually is quite the opposite. It's significantly regulated, which is to our benefit.
Long as the paperwork's posted in the window.
Yes, yes. Last time I checked, we don't have the C next to our county, but it is regulated. It is regulated.
I would just have a comment, which is that I think, although it's a serious condition when you get it, most people will attest that they are injured often from trying to shuck the oyster.
All right, thank you, Kate. We appreciate that. Now we move into agency reports, starting with Executive Director Andre Fresco.
Yes, thank you, Mayor Byers. Good morning to the board, to our guests and to the public. Grateful to be here. I wanted to start off by sharing my appreciation to the environmental health team. You have heard a lot from environmental health lately. The reason is that there are increased significant concerns in environmental health in our valley. We work in partnership with the state, also certainly with our municipalities, but very closely with the county. So we have an appreciation for that. That's very important. But I wanted to also share that this is an example of what we try to do when we work on internalizing a structure of support, not just for the public, but for the system. We're not just responding to environmental health issues, we're building the structure and the strength of purpose around that. So it may not be evident, but I wanted to share how closely our team internally works with the state, but also interdepartmentally. So when you have something like an environmental health concern around a foodborne illness, it's no longer an environmental health issue solely. It's a medical issue. It's a concern for the safety of that person. It's working with our nursing team and certainly with doctors and nurses, nurse practitioners in the valley. It's working with hospitals. And sometimes it can be a multi-state issue. So the histories that we have to take and the fact that people visit us frequently and then go back to wherever they live means that that illness travels with them. So it's really complex. And in fairness, it's not the kind of thing that people build structure around. It's usually considered an emergency or a one-off. We don't view it that way. This is about a strengthened public health system. It happens to start with environmental health, but it usually ends with a medical care issue. And so I just wanted to share my appreciation. Having something like Kate as part of our team, certainly Shawn, Stephen, who was referenced earlier, it's part of a strengthened structure that allows our staff to do their job well, but work within a structure that normally doesn't get the light of day. And that structure is not exciting. It's complicated. It takes a lot of cross-training, but it results in a much safer community. And that's something we've been working on for the last decade. So I'm really grateful. I just want to share that's the kind of thing that happens that people just don't talk about. I wanted to transition to statewide issues. We have a new Secretary of Health, as I've mentioned, with the fact that the Secretary of Health comes from local public health. There's an increased awareness that having a communication chain or opportunity with the state is very important. We have received a lot of support on a number of different initiatives and programs. It's an improved relationship, which I'm grateful for. I think it's recognized that Yakima as a county has many needs. Some of that is evident because of things like limited purpose landfill issues, and so it's a statewide awareness. But it's also a recognition that we're a large county serving a large population that has real needs. And it's also an impoverished community that requires our attention in tough times. And we're receiving that kind of support from the state, which I'm grateful for. The other is, as you saw when you came in, and again, I apologize that we didn't share that the typical entrance to the meeting is now a pallet storage area. But we wanted to have a place where we could bring storage in bulk and it not be in a place that could be dangerous for staff or inconvenient for employees and clients when we're operating. So, the bottom line, though, you'll hear from Ryan is that things are going well with the building, but I also wanted to share that we've tried to be prudent with our finances. We've been interested in renovating the building for years. And we received a grant from the Group Health Foundation years ago, and part of that we intended to use towards this building, but given the pressing public health priorities that we had, we postponed the renovation. In the interim, the Group Health Foundation has now been renamed the Untitled Foundation, but they're still supportive of our interests, which was focusing on how we could make the building more inclusive, more dignified, more welcoming to people, and also provide a more dignified environment for providing services, which we're able to do. So we're hoping at the end of next board meeting, the entire renovation will be complete and certainly join us for the tour. But we're able to provide services, I think, in an improved way. Reason I share that is that we had a remaining amount of $447,000 from the group health commitment, which we're able to use, and that's coming through on enhanced budget. And I share that because, again, the board was comfortable in supporting use of the enhanced funds, but those funds are coming from the Impact Foundation. So we're really grateful to use those dollars because they add to the bottom line, but it's not taking away from our public health services. So, any questions? That's all for me then.
Thank you, Mr. Fresco. We'll move on to Chief Operating Officer Ryan Ibach.
Okay, just expanding on what Andre mentioned about the remodel, we are almost completed phase one, just a couple last end of the phase of things that need to be done, like lighting indoors that are on back order. So those should be done in the next couple weeks. Phase two has started, and that's more in the employee area, and so that should be completed by September 12th. Is the date to be finished, and then we look forward to showing everyone next meeting the remodeled areas. You have with you in your board packet a fee schedule for proposed fee schedule for 2026. I'm happy to announce that there are no increases for 2026, and so it looks exactly the same as 2025. However, we do expect in 2027 that we're going to need to raise some environmental health fees. They have not been raised since 2001, and we're probably the lowest in the state, if not the nation, in environmental health fees. We do have some reserves in environmental health and environmental health reserves that we plan on using for 2026. And so when we draw all those down, we'll probably need to raise fees in 2027. So we're going to be taking the next year to, as a committee, Kate, Shawn, Chase, myself, Andre will be discussing, doing research, and then coming up with options for the board to decide on moving forward with the increase.
Just a quick question. What's the level of your reserves for environmental health?
Approximately $500,000. It'll start to tick down, probably closer to $400,000 this now. Yeah.
So Ryan, we had, when I joined the Clean Air Board, it was a similar situation where fees hadn't been raised in quite some time. And then of course, with salary changes and everything that happened with inflationary cost of goods and services, especially if you would drive around and check out things. What we opted to do was on our notice, make sure that it was clear that we do know and intend to see an increase, just to try to get the community who uses those services to at least kind of be prepped. They don't always, you know, it's still going to be a bit of a shock, but just to try to proactively communicate that they expect an increase.
That's a great idea. Thank you. Do you mind if I share? we were able to generate some reserves because we had an inflow of money coming in. We didn't think it was appropriate to raise fees if we had reserves. Certainly doesn't seem appropriate. But also, we recognize that these are tough times. And one of the unfortunate realities of not raising fees incrementally over the last 15 years is that it does seem like a massive jump. So we want to give options to the board, and that's something that Ryan intends to discuss with during the future about how we do so.
So to that point, I think for me, I mean, this is my third year on the board, and you know, when you look at the fee schedule, there's a lot of different fees. And then when you look at our budget, we're a very healthy budget. We have over a year's worth of reserves. And so the question I always have is like, okay, are we at a point where we can actually reduce fees since we have such a large reserve, knowing of course that the reserves aren't necessarily tied to our fee schedule. I mean, they're public health funds and whatnot. But it looks like we bring in 1.7 million a year off of fees, and that's why, at least that's what we budget for, which is still a large chunk of change. I would be curious, and if the board's interested in looking at this, I mean, could we potentially move forward without having to charge for birth certificates and death certificates? I appreciate the fact that we don't charge for our veterans, but I'm just thinking, you know, birth and death are kind of a natural occurrence. Is that something that the health district can just, I guess, subsidize with all of our other functions?
Gabriella can back me up on that, but that's actually a state mandate.
The dollar fee?
Yeah, the dollar amount.
To charge them. Okay.
Yeah.
And I would say I've had a few folks reach out, you know, upset, like, you know.
There is gonna be something coming in about, students that are gonna be able to get certificates, but we're working on that in internal policies.
Yeah.
And actually, we wanted to, and if the board is interested, I'd like to continue to pursue that, but we wanted to consider a waiver for people who were coming out of domestic violence, people who were coming out of being unhoused, certainly children transitioning out of the foster care system. There's folks who don't have the money to pay. And so, but we also ran into, when I said I wanted to do that, essentially, I was told that if we chose to do that, we would be gifting public funds. And so we have to be careful with that. But to your point, I think that is one of those areas where it would be wonderful for people who do not have options to have that. It would be wonderful, I think, for young people graduating from high school, making certain that they didn't, you know, having as an example, a food handler's card, I think means that you can earn a wage. But that's not something that everyone gets, because you have to pay for it, and not everyone frankly has the money for it. So
Yeah, well, I appreciate you guys looking into it.
I'd like to, let's revisit it.
I wonder if we set up, if it would be possible to set up like a fund of sorts, an RFI fund or a high needs fund.
Sure.
That way it's maybe not gifting it, it's we're putting it into a pool, and then those that qualify could use those funds.
Yes, and I think that specifically, I think that works with the veterans now. There's going to be a way to identify that individual meets the requirement. So I think that there's a new standard for that. And I also, this is not, I don't think that, as you said, this needs to be about revenue generation. This has to be about doing the right thing. So we can certainly look at that. Thank you.
Generally, I'd like to add to the board's information, we look at programs individually, and generally in the vital records program, we don't make, if we make money, it's not very much. For every birth death certificate that we sell, a portion of that goes back to the state. The $25, $13 goes back to the state. For death certificates, for additional past the first one, they're $25, $20 goes back to the state. So the majority of the revenue that we collect for that does go back to Washington State. They consider that it's the paper more than anything else. We cannot refund birth or death certificates, but we can exchange them. It's the paper. We keep daily tracking of the paper. It's considered in a way like insurance.
I see.
Can't be forged, those kind of things.
Okay, so there will be a public hearing for a fee schedule at the next meeting, and then the board will be able to vote on whether or not to approve the fee schedule. And then also at the next meeting, we'll be presenting our proposed budget for 2026 as well. That's all I have.
Thank you, Mr. Ibach. Any questions? We'll move on to our financial report from Chase Porter.
Good morning. Kind of piggyback onto the budget. We'll be presenting a budget next month for 2026. We are entering into a little bit of a tougher time for budgeting wise. We are seeing reductions in federal programs. And so year over year, we've always used the operating budget has always been in the black. The operating budget has always supported itself. We've had programs. If we have a program, the funding needs to support the program. We're starting to move away with a little bit, and we're seeing that more in kind of the EH program. They're doing more every year, and wages increase as well every year. And so this next year, could possibly be building a operating budget in the red, using enhanced funding to support that piece of that operating. We want the dust to kind of settle a little bit in EH. We're going through some CBAs, and so there's some unknowns with federal dollars. How the CBA is going to land this next year, 2026. The plan is to use our reserves. We have reserves to use those possibly for wages. That's not normally a operating that we do, but this next year that we're looking at possibly doing that. Or other attorney fees, other operating pieces. So we're coming up with a budget, and it's going to be a little bit tougher than it has been over the past few years. And so the idea really is to get the real cost of EH in 2026 and looking at possible fee raising for 2027. And we'll be coming to the board with different options. If we want to do one big one, incremental, if we want to do COLA adding under those kind of things. And so we'll be talking more and more about this over the next year about the possible. We don't want to take fee increases lightly, especially if we've been posting gains and we have reserves. We want to be very thoughtful and intentional about that. So next month, we'll be looking at the budget. That'd be the plan. Right now, we're currently going under an audit. We had our entrance interview this past Thursday. So there's an engagement letter that needs to be signed by the commission of buyers. And then we're moving forward. And so far, so good. Steady as she goes with that, with the audit. Moving into the financials. Starting on page, if you're following along in the packet, page 9. For the month of July, we had a loss of approximately 158,000. And then for June as a period end, a lot of different grants have a fiscal year end of June. And so we had to keep June open and post some additional expenses that came in for that period back to June. And so we had a $15,000 loss for that through that. So we're bringing our total annual loss to approximately 1.4 million. Our allocated budget of revenue through the month of July is 7.8 million. Our actuals coming closer to 6.3. And for expenditures, 9.1, and actual coming in closer to 7.7 million. Any questions? All right, moving into the next page. I'm not really going to speak to any of the revenue piece. For expenses, we're starting to see enhanced programming. We're starting to see building expenses come out. So we spent approximately $400,000 so far in the building, and things are going well with that. Are there any questions on this part of the income statement? Seeing none, moving into the next piece. Just moving on down to the bottom. So for last year, we have FPHS funding. FPH funding is in a fiscal format. So it goes July through June. Government accounting is a little wonky. If you have the money, you gotta recognize the revenue. So all of that revenue that's supposed from more or less January to June were posted in 2024. So carrying that forward, we had $2 million of carry forward from 2024. So factoring that back into our annual loss, we actually have a slight gain of $650,000. And that will tick down throughout the year. We do expect that to tick down. Any questions on this section? All right, moving into program specific. Again, not really speaking to anything in particular. July beginning a period or beginning of a period of a fiscal period for many of our DOH programs. We're still waiting for some of those contracts to come through. So there was some invoicing that we weren't able to do that they have come through this past week. We'll be able to collect on some July invoices. Any questions? Moving into the second page, nothing specific. Comment towards unless there's any questions. And then last page. Same thing, unless there's any questions, I won't speak to necessarily. All right, if there is any time, please let me know. Moving on to the last page, our July cash flow. We saw a slight uptick in cash and for the month of July. We get flexible dollars, foundational dollars, $1 million every year. That's separate from the FPHS money. We received that money in July, which is about $500,000. I am expecting FPHS funding to come in. It comes in, it's approximately $3.7 million. It's going to come in $1.8 million chunks. So I'm expecting to see that here soon. We just signed the contract for that. So hopefully, if it doesn't post in the next few days in August, I would expect that to come in September. So we will have another uptick in cash. Any questions? All right, that concludes my report.
Hi, thank you, Mr. Porter. We are now moving to Health Officer Dr. Dave Atteberry.
Sure. Thank you, Mayor Byers. So the month of August was an interesting one and a diverse month for the Yakima Health District and for public health, starting with infectious diseases. We saw a report of a case of malaria out of Pierce County earlier this month. The thought was that its vector was probably a mosquito who bit the person and then previously had bit a person from an endemic area. This would be the first case of malaria west of the Rocky Mountains in the U.S. For the year, and it's an important one to keep an eye on. The patient is recovering and getting treated. Treatment is with a combination drug therapy, and we will keep our eyes peeled for that and any other cases, obviously. Tuberculosis is still at an elevated level. 12 cases that we're currently following in the Yakima Valley, 6 of which are with our partners at the Indian Health Service. Obviously, treatment is long and duration, and we do our best to keep an eye on making sure they're compliant with these medications. A lot of the medications that we treat tuberculosis with are rather toxic, and therefore the people have side effects, and so we have to continually monitor their compliance with them and then trying to get them through what's a hard phase. As we heard earlier in the spotlight, Vibrio contamination in shellfish in the Puget Sound has been seen. Obviously, it's an annual occurrence, and for August, we tend to see our peak numbers, and that is true for this year as well. Certainly, we're not as bad off as places such as Louisiana, where I think there were several deaths reported earlier this month. From that area. So we have a better, I believe, monitoring system here, and it's more robust, and we really kind of tag all shellfish and where it comes from and how people consume it. And I think there's a greater public awareness really of eating raw shellfish and just being careful that where you're getting it from. Certainly if somebody who enjoys that, I would hate to see it go away and keep the Tabasco sauce coming. Measles continues to be seen at concerning rates across our nation, and really I will continue to pound the drum of vaccination is the best way to avoid measles, and we should continue to encourage all available to be vaccinated and to continue to get vaccinated to protect those among us that cannot be vaccinated. West Nile virus and mosquito sampling continues in the lower valley. We've seen a few positive samples, and we're doing a more robust look into how much of that is present, and then monitoring really treatment against that is surrounding not getting bitten by mosquitoes. So wearing long sleeves, wearing EPA approved mosquito repellent are all important steps, and then avoiding mosquito-ridden areas, stale backwaters where they are known to breed is important. So just be aware. COVID-19 continues to be present, and we're seeing numbers of the most recent variant that mirror the national averages. And as an effective preventative measure, we continue to encourage vaccination of those at highest risk, and to continue to monitor that situation. On that same note, flu vaccines will become available in mid-September. We encourage all people at high risk for flu, those that are elderly and immunocompromised, to get flu vaccinations and continue to stay up on that. And then finally, I guess, the first human screwworm infestation. That sounds pleasant. It was seen in a resident of Maryland who had recently traveled to El Salvador, an endemic area for the screwworm. This is a nasty parasite and really needs to be kept a close eye on because it can get out of control in livestock populations. And we have not seen any of that in the US. And so, but we will keep an eye on it because where you see the organism, you tend to see infections. And this is a final note, you know, I think that as I go through month by month and we look at public health in general, I'm reminded that all of us that work here in public health stand in the trenches of what are potentially catastrophic health conditions that would be detrimental to our population served. And so I just congratulate everybody that I work with on a monthly basis and just give them kudos because they really are kind of fighting a war against infectious agents. And the minute we let our guard down, we will see pop-ups of these diseases, which we would like to go away, but they don't seem to ever want to. So with that, that ends my report for the month. I'll open to questions if anybody has any.
I have a question. I don't know if it's, and maybe Melissa, you may be able to tell me too, but I had to get my son his Tdap, the 12-year-old, and the urgent cares all said that they did vaccinations, but they don't do that. And you have to go to the general physician's office and it had to be pre-ordered. Is that a requirement? Is that I'm asking for all the moms, because I thought I was gonna slide in right before school started real quick and.
I believe it's a storage issue related to whether they keep the right refrigeration and whatnot on hand to monitor.
That's a pretty routine one. Was the Tdap?
Yes.
Yeah, that's not a rare one.
Which is a pretty routine one.
Yeah, but I went to two med centers and they both said, no, we don't do that one and you have to go to the general.
You can also go to pharmacies like Safeway, Fred Meyer, Titan Village. They will all have those. There's also a lot of pop-up clinics for going back to school.
I did get it, but we got to the general, we actually got it not too bad, but they had to order it
It
pre-order.
could be because like in the ERs, if you need a tetanus shot, they might give you just a tetanus.
Yeah.
They're not gonna do the diphtheria and pertussis, so they might have just the tetanus vaccine. So maybe that's what the urgent care's rationale is. They're only giving out tetanus. They don't have storage to keep the Tdap on hand. Which is, the Tdap has the tetanus, diphtheria, and pertussis
Yes,
all in one, whereas the tetanus is just the tetanus.
Yeah. Aileen, is it stored differently or what's the?
You know, I don't know. We didn't deal with vaccines.
It's the same, they all have the same refrigerator, it's just a matter of what do they use the most, because they don't wanna buy vaccine and it comes in, you know, lots of 20 or 50, whatever it is, and then have waste, so they probably.
Well, the waiting room was full of moms like me trying to get the sports physical at the.
It does sound like it's a business model issue.
Yeah,
Right.
that's what I was curious.
Say if you do more sports physicals and less vaccinations, it's generally better lucrative for your clinic. But
Yeah.
With that said.
Thank you.
And a lot of times for children under 18, most vaccines are free for children. In the state of Washington, they're all part of the vaccine for children program. And so it could be that they aren't participating, if their urgent care not participating with that program. So they're referring them out to the community partners that are.
Thank you. Thank you, Dr. Atteberry. We'll move on to disease control with Melissa Sixberry.
So earlier this month, we hosted over in another facility, but HIDA, Mike Meiser with HIDA, which is high intensity drug trafficking area, or ODMAP, was here along with Amanda from his agency to talk about the drug trends in Yakima County. We had a representation from first responders across the county there. It was a really good meeting. Takeaway was that the community members, the ones who are first responders that are using ODMAP, were using it in different ways, but the responses or the opinion of it is well received. Everyone seems to be using it differently. Law enforcement is using it, and some of the other agencies are using it to look at how much manpower is being used for overdose responses and delinquent funding. Public health is looking at it to see where our trends are, where do we need to do more education and prevention work. But everyone seems to be using it a different way, and everyone is very grateful for the ODMAP we brought to this community. One of the things that came out of there, Mike Meiser had said that Yakima County is the gold standard. He hasn't come across another area in the state and kind of nationally who has used the ADI, which is the analog digital interface, like we have been able to, and get all of our community partners on board. to use this interface or manually enter the data. We have more. Alicia's, oh, she's happy. Good.
Congrats, Alicia.
Yeah. So we have people using it within this county than across the state. And in fact, someone from Ben Franklin Health Department came here to learn what we were doing. So great work to Safe Yakima Valley, the county, everyone who kind of done that project.
So there's still no outward facing dashboard or anything for the general public to peek into it.
Correct. There's not, but it does give us an idea of, so what we're currently working on is with this data, we're kind of creating more now our overdose response committee. So when we have these spikes in overdoses, what does our response look like? What is each, department going to be responsible to do? Do we need outreach workers to then go out in the community to let people know there's an increase in overdoses right now? Make sure you have your Narcan, et cetera. Law enforcement needs to know for their staffing purposes, for their funding, but no outward facing.
When can we see the outward facing?
That's an OD map issue. That's a HIPAA.
I don't anticipate, that would be like the Department of Health making their dashboard public facing. So it will be dependent upon Safe Yakima, the health district, various entities sharing it with the public. One of the things I'm doing is working with the 4 largest fire departments as well as Wapato Police Department in creating 1-pagers for their city councils to review so they can see the costs, how many calls the law enforcement and firefighters are responding to, so we can assign a cost to that so community members can see, oh, no wonder why it's taking them so much longer to get to grandma and grandpa's house, when grandma has a heart attack or is not able to breathe. Those types of things, but I don't anticipate that it will become a public facing dashboard because the PIN dots reveal too much HIPAA data. So if it's in Mabton, they can really hone in and say, oh, that's Susie's house, even though it may not have been Susie who had the issue. Department of Health has made it abundantly clear they do not want that in public facing hands. So the primary purpose of ODMAP is exactly what Melissa said, is to identify the hotspots, to identify the spikes, and then each community will come up with a plan that works for that community to respond accordingly.
So I absolutely understand that. We deal with something similar when we have our well testing for PFAS. It is a privacy issue. The workaround though is to do a spotlight map where actually you're not able to, to Commissioner Curtis's point, I do think it's important we have something forward facing, even if it's a once monthly map that is manually done, that simply puts a corresponding size and redness of dots over certain at least neighborhoods and townships, because it is important that people understand where those calls are from. And there is absolutely a way to do that without unintentionally identifying addresses specifically. So I think it's important that we work towards that.
You're right. You're right on that. And ODMAP does allow us to do what they call the heat map. And so it will highlight those areas, and that we can absolutely share. Our epidemiologist is currently working on a quarterly report that will be, there's the internal one, there's the our overdose response committee, who's law enforcement, us, and then the one that's outward facing. So she's just kind of making it so which one is appropriate for sharing for each.
Totally agree and understand the complexities and the legalities there, but I do think the sooner rather than later, we can at least get the heat map up regularly for the public to see that that's going to be very important.
And most of you shared the continuing investment that we want to make.
Yes, so Yakima Health District provided the funding for the interface for the first year for Yakima County. So the law enforcement who use Spillman with the county, it would interface with ODMAP, so they don't have to manually enter it when they go on a call, it automatically goes in. And Yakima Health District is also going to be doing that for the second year.
I want to thank the board for their understanding that this is really more than a public health issue. It's a coordination issue, and we want to be supportive of our partners in the Valley because it's complex. These folks already have a tough mission, and putting information in, it's complicated. So we're really grateful, and it's been a great partnership with Safe Yakima Valley and certainly the county, but also all the municipalities. It's really working out. It's taken a long time, but it's working out extremely well.
And I know the day that ODMAP was here, they also went around and had a meeting with tribal public health chapter, tribal law enforcement. So I think it will be soon that they'll be getting onto ODMAP as well, and then we will have a really good picture of what's happening local. And again, this information is all real time. This isn't data that's coming in 6 months later.
It'll be interesting to see. I mean, again, I applaud our efforts and, you know, you mentioned that we're being looked at as the gold standard, but you know, this is kind of phase one, right? Like tracking the data. Phase two is really like, are we able to inch people into getting the treatment that they need? Yeah, we're saving lives and we're tracking anytime Narcan's administered, but like the real success will come into getting people well again. And I'd be curious to see how we track those, you know, that phase of things, because I mean, we all know this, but our first responders are exhausted, you know, our 911, our fire folks, our AMR folks, they're just exhausted.
I can tell you one of the number one barriers that we have experienced, and other communities are similar, is we have had actually from the outreach efforts between YPD and Comprehensive, we've had several individuals that said they were ready in the moment to go to treatment. However, they had no place for their pets. So we reached out to the Humane Society to see if they had capacity, even if we had to supplement funding, like going to Community Health Foundation or go through the health district to ask for funding, you know, because let's say it's 2 or 3 a month, say for $1,000 a month, they have zero capacity. They gave us names of 3 different places that foster pets. None of them have capacity to accept the pets. So right now, that is the largest barrier we're experiencing, is truly, we have people that say, I'm ready to go right now, but what am I going to do with my pet? And so we're working closely with Comprehensive to find solutions for that.
Issue. If people would license their pets, we would have more resources to take care of it. But absence of that, there's no funding.
Well, and we run into that with our shelter
Right.
all the times, you know, but whether we like these folks won't admit it, but I mean, these pets are barriers, you know. I mean, if you're got a substance use addiction, you should not be taking care of a pet, like can't. So
Well, except they're a source of security, they're a source of.
the coping
They're also an
mechanism.
excuse.
Yeah.
They're also property.
Yeah, that's true.
Treatment so they can get another pet when they get out.
That was all Melissa.
Yeah, go ahead.
The next thing I'll touch on is, Andy mentioned to us this morning, if everyone noticed it's a little bit smokier this morning, that is due to the wildfires that are happening around us, partially from the one in Mason County and also Lake Chelan, and then from Canada and Alaska as well. So our current air quality index is at 66, which puts us in a moderate level. So again, we'll be doing some messaging to our local school districts, just as a reminder to look at the WIAA website for air quality index, along with heat indexes, to as a reminder for this time of year when we've got people practicing sports outside of football, with school just starting up, as a reminder when those outdoor activities should not be happening. With that?
And soccer.
And soccer. Football, soccer, tag. I don't know all of them anymore. Softball, I don't know. Not swim though, sorry. Well, maybe swim. Something's outside. I think of swimming is usually indoor, but somewhere outside, right, Jace? And unless there's any questions, I'll stop there today.
Summer swim ends July
couple weeks.
31st, yeah.
Thank goodness.
Yes.
Any other questions? Thank you, Melissa. We're going to move on to environmental health with Shawn Magee.
All right, good morning, everybody. We are starting to wrap up on our summer seasonal inspections, which are things like sanitary surveys, summer camps, a lot of our outdoor heavy inspections that happen generally mid-spring to leading into the fall a little bit. So we'll be transitioning to our fall winter inspections, which are generally the more indoor things like schools, just school food, and we'll be having our concession stands for sporting events, things like that. So we're slowly making that transition, although our land development programs are still very busy as people make the mad dash to get their septic systems put in, but before the weather turns bad, the ground freezes. We've recently seen an uptick in animal bites and potential exposures, especially with bats. Yeah, bats just keep finding themselves in areas they shouldn't be. And we've had around 3 over the last week and a half that we've had to investigate and make sure that folks weren't actually exposed to.
Are they kind of in the same area? Where is that?
I don't know the geographical location.
All three were in Sunnyside.
All 3 were in Sunnyside. Yep, the bats are hanging out in Sunnyside right now.
You'd be amazed how many people, you'd be amazed at how many people find bats in their house when they wake up. There's a bat flying around in their bedroom, and because you can't, you have no way of knowing while you were sleeping if that bat made contact with you. So in those cases, we always recommend post-exposure prophylaxis.
Yeah, and bats are the primary vector of rabies in Washington State. So and we keep a very close eye on those potential exposures. Unlicensed food vendors is still an ongoing issue throughout our county and beyond. Many of you may have heard City of Tila passed an ordinance recently that kind of stiffens the penalties and punishments for operating unlicensed pop-up food stands within their city limits. And we continue to work in partnership with City of Yakima. And we're starting discussions with City of Sunnyside as well, as they're starting to see a real issue with pop-up unlicensed vendors. We'll keep working on that issue here locally and keep meeting with partners outside of our county and even state on continuing to find solutions on how we can address the issue. We have recently heard from the State Department of Health, recently in the Environmental Health Directors Committee meeting a few days ago, that they are in active discussions with the Assistant Attorney General's office on how to address this issue and support local health or even step in and assist. In addition to that, we're still working with DTG on several different issues they have going on. They recently finished the excavation of the Atteberry Hill area and got that waste transferred over to their line cell. That's the good news. Through that excavation, you may have heard or seen an article that there have been several small spot fires at the facility, which they communicated to us right away. They deployed a 24-hour fire watch team to keep an eye on the facility around the clock. And the reason for that is excavating this waste is actively decomposing in that temporary area. And we did have a problem with tires and mattresses going in there in the past. So those, they open that cell up and oxygen has easy access to that waste. You know, it can cause combustion. So we have ordered them to remove mattresses and tires as they find them in that area, and they'll haul those off to an approved facility. And in addition to that, we are working on some different differing opinions across the state around material recovery facility residuals and how that relates to going into that LPL. Certainly LPLs are a big topic of discussion around the state, so we're actively engaged with those with the Department of Ecology and how that's going to look moving forward. And if there's any revisions to any Washington administrative codes that need to happen in light of House Bill 1154 that recently passed. We're actively engaged in those. Solid waste is a big topic here locally for us. And if that's all I have.
Any questions? Thank you, Mr. B. We will move on to the.
Yeah, good. So I just want to make sure I understand you clearly. So in light of 1154, is the health board looking at creating a
So I think that would be something the board would have to decide. I'm not entirely sure. The health district has not in the past, at least since my time here, been an agency that can issue fines and penalties. So this bill is really new to us, and the abilities that it may give us is new, and that's going to have to be a more robust conversation for the long term. And if that is something that was
implemented, what's gonna be the procedure for that? And Department of Ecology is going through the same process. They are very, much focused on how to develop a protocol where these penalties are appropriately used, and then what's the collection method of that?
So on that note, then, so the state's looking at that, that's good, might be.
They're actually required to, so ecology has to come out with their own rulemaking, so nothing's going to happen fast, only because first you have law. Then it goes to the enforcement agency, in this case, it's ecology, and they have to go through their rulemaking process, and that has to be vetted out before then, I mean, it's gonna take time.
So we're gonna need to wait for the state first on this one.
I think probably our council is going to advise us that we should really move into what the state does, so that we don't preemptively put ourselves in a position where we're accused of creating improper fines that are excessive, or, I mean.
Yeah, and specifically WAC 173-350, the WAC that is, regulates limited purpose landfills, is the one that's, being looked at to be revised to incorporate the new law.
And if I may, Commissioner McKinney is totally right. We're moving at the speed of government. with this issue. But the other is the complexity that we don't currently have the privilege to levy fines. That would be a board decision, but the complexity, and I believe Commissioner Lindy, you and I had discussed this specifically, is who would then issue those fines? Would it be the state or the local health district, or both? And we don't want to double fine in a sense. Also, there is complexity because, again, we may be able to issue fines, but if we don't have a means of enforcement, then it can be more symbolic. Whereas the state, it sounds like, is intending to have an enforcement arm connected to the Attorney General's office that is going to be robust. But that's where it's confusing to us in terms of moving quickly. It's not going to solve the issues that we have currently. But I will share that because of the issues that we've had in Yakima, as a county, those issues are pressing and elevated at the state level. So I think we'll be included in this.
And the issues we currently have, those take time as well, because our decision-making has a ripple effect, across constituents, across, our county that utilize these facilities. And that's important to take into consideration, but compliance is the goal, and compliance is what's going to be achieved through these facilities. But we also have to follow what the regulations say and stay within our scope of authority that those regulations give us. And those regulations give these facilities the right to discuss those and appeal those decisions if they don't agree with them. So we have to be very thorough in our decision making and very document the timeline and the events that happen to show that make our decisions defendable, more or less, and that takes time.
Well, from the little bit that I've spent on it, I mean, our health district is unique, we're a quasi jurisdictional thing that's not necessarily under a county government, because, you have health departments across the state that are in county government. And so then you have different levers that you can pull and whatnot, where this body doesn't necessarily have all those bells and whistles. So it'll be interesting to see how this all plays out.
We'll definitely bring the options to the board, and the board can make the determination of how you wish us to move forward.
Yep.
Shawn, when we were talking about their processes that they're going through right now, it sounds like you're saying they're getting some things in place, so they're uncovering waste that had already been buried and stuff to transfer that over.
Yeah, so
Lined area.
essentially, what was done, a groundwater. Groundwater study was done, and one was done when this landfill was created, and it indicated the groundwater was several hundred feet below ground surface. There were several impervious layers protecting that groundwater, and it was a designated natural liner. And so that's why the original cell was not required to be lined with a synthetic liner. And then when that cell was being filled up, there was A lot of questions around, is the entire facility area, the entire property approved to be a landfill, or do we have to do it cell by cell? And we required a cell by cell proposal, operations plan. And in the interim, allowed them to utilize an area on the south side of that original cell that was going to be integrated into that, in the long term. We found groundwater was much more shallow. The decision was made by the landfill to excavate down into the ground, which excavated an unknown portion of that natural liner, leaving groundwater vulnerable. So that's when we required cell 2 to have a geosynthetic liner in place with leachate collection, which is protective of groundwater. And then they were to remove the waste in that temporary fill area and put it on that line cell. And that was to eliminate, potential for leachate to reach groundwater.
Okay, so they are uncovering
They've already done it. It's-
stuff or
yeah.
had, well, I guess the reason I'm asking that was just made me think, because you specifically mentioned tires and mattresses and their pictures specifically identified tires and mattresses. So were they maybe not seeing new waste, but uncovered waste as it was being transferred?
Yeah, what I saw out there when I went out for inspection to interpret if the temporary fill area had been fully excavated or not, were stockpiled tires that they had pulled out of the waste from that temporary fill area. And when they started using that, we did have an issue with them accepting tires and mattresses, or missing tires and mattresses, and they didn't get them out of the trucks before it went into the working phase. Whenever we saw them, we required them to pull them out, but and they are under our direction to remove any mattresses, tires, or any waste that's not on their acceptance list that they find. They have to pull it out and take it to an approved facility. We haven't seen so much new mattresses that look new. Most of them are pretty broken down and dirty. There was one that looked a little suspect that we told them to remove, but yeah, that's the expectation, and that's what their permit requires, is no mattresses, no tires.
Any other questions for Mr. Magee?
I guess, Shawn, just a question, but how do they screen for that? I mean, what's their, how do they know whether their trucks were coming with mattresses and or tires?
So at their scale house, they have an elevated
Platform they don't want to.
platform, and they can look down in the trucks, and
Got
I believe they have a camera that can look in the truck as well. But that's also part of the issue, is what's underneath that top layer. You
Right,
can't,
right.
A 53-foot trailer comes in full of waste.
Right.
Sure, but if that load is going to the material recovery facilities first to sort out recyclables, and then the residuals from that move on, they certainly have the opportunity to pull those things out at that time.
Any other questions? Thank you, Mr. Magee. We'll move on.
I have a question real quick. Do we have a status on the letter that we are generating regarding the pop-up?
That's gonna come up later on the agenda, Alicia.
Okay, great.
Thank you. Any other questions, Mr. Magee? Thank you. We will move on to public health partnerships with Lilian Bravo.
Thank you. To start, since it's back to school time, we'll be focusing on immunizations as the update for today from the Public Health Partnerships Department. So just as a reminder, the Department of Health used to have a caravan service which provided mobile vaccination services all across the state of Washington. That did conclude in the month of June. That was a big loss, however, because that caravan was used quite a bit here in Yakima. It traveled all over. It provided immunizations at different community-based organizations, but also and so with that, that's what we'll be working on with our local partners. We have Yakima Neighborhood Health Services, the Yakima Valley Farm Workers Clinic that already have mobile services in place. However, even as they support some of our bigger school districts, there is a need to continue to scale that up, because as Commissioner McKinney mentioned, there is a need to make sure that we get everyone immunized back to school, but then also for some of the seasonal vaccinations that take place related to flu and COVID as well. So more to come as we explore those partnerships and how we can do that. Essentially what we're looking at is looking at pharmacies, potentially the urgent care, and of course working with students to be able to support the scale up that is needed to meet the need that is now has now been left after the caravan service is concluded. And in case it gets confusing, the caravan will technically still be in place, but they won't actually be providing the immunization services. So they'll be out providing health information, but the actual immunization, the vaccines, those won't be provided anymore through that anymore. Outside of that, this year we will be placing a higher emphasis on vaccine communication specifically. We know that nationally there is a declining confidence in vaccines. So what we'll be doing to address that here locally is to share and develop clear fact-based information and rely on our trusted messengers, specifically local providers, and making sure that we're able to provide that information to community members and address some of the common concerns that come up. So that will also be in development over the upcoming year. And everything related to this can be found again on our website, yakimavaccines.org, or in Spanish, yakimavacunas.org. We do also plan to do what we do every year, which is update a list where people can find where they can get their flu COVID vaccine in their community, as well as the associated costs, given that there is some question about what will be covered by insurance in the upcoming year. In addition to that, just for general awareness, the Public Health Partnerships Department will also continue to support the EH program, specifically with education and outreach related to the food program and groundwater initiatives. Then this is again to help support vendors stay compliant and build community trust in the services that we provide. Really briefly, we will also be helping to promote food security via community gardens, which I updated the board on last month. And then we'll continue to work on our behavioral health work, specifically with NAMI, to provide training to community partners to provide services to families, such as OIC, La Casoga, different sport coaches, so that they're better equipped to be a resource to youth to hopefully prevent substance use. So I want to just give a quick overview on some of the different initiatives. I'm happy to go into specifics, either independently or if you have any questions as of right now.
Questions for Lilian this morning?
Lilian, a point of clarification on our website, the Health District website, will there be an update about the caravan and like that there will not be vaccines available and where people to redirect them if they're used to getting them from the Health District? I was unclear on that point.
Yes, so all that information is on yakimavaccines.org or in Spanish, yakimavacunas.org, and that is listed, and if, I believe, and if not, it will definitely be so. And that's where we keep the current list of mobile services and events that take place all across the county. That is
Fantastic. Thank you for clarifying.
Yeah.
Thank you. Any other questions? Seeing none, thank you. And we will move on to community programs with Gabby Alvarez.
Thank you. Good morning, everyone. So update for breast and cervical health program. We successfully wrapped up the fiscal year screening 1,892 patients. It is an increase of 200 patients compared to last fiscal year. And from these screenings, 8 patients received breast cervical diagnosis or breast cancer diagnosis, sorry, and 1 received a cervical cancer diagnosis. So these outcomes highlight the critical importance of our screening services and supporting early detection across our community. Moving to developmental disabilities, the Developmental Disabilities Administration, in collaboration with YHD, Parent to Parent Program, will be hosting an application information night at Children's Village on September 5th at 5:30 p.m. This event is designed to help families complete the DDA application process. This application process is now taking up to a year for approval, so it's taking quite some time. We are making sure that applying early ensures the families that they are enrolled by the time these services come up later on. So they are connected to job foundations and employment services when they're in high school and already finishing up high school. So we're trying to get these kids to be enrolled early and on time. DSHS is falling back with approving this just because they are going to be short-staffed. So we're just making sure that this is accessible and we're supporting as much as we can. In other news for DD, we will be audited October 9th. We have already begun preparing, gathering and organizing all the required documentation to ensure that we have a fully compliant and we are ready for review. So that concludes my report unless you have any questions.
Any questions for Ms. Alvarez this morning? Amen. Thank you very much. Now we'll move on the agenda. Next up is unfinished business. This is a cross-jurisdictional criminal enterprise ring letter written by Commissioner McKinney, thank you very much. Open for discussion.
Well, as the writer of the letter, I guess I will speak to it. I thought it was important to just keep it very brief. We had asked Shawn to give the board updated information, and when we opted to send the letter, I reached out to him directly and asked him to just provide his own words of the bullet points and issues. So I didn't want to speak for him and his team on their experiences, but rather their observations. I thought it was important to come directly from him. So it's brief, it's to the point. I believe I covered all the bases and included everyone under the sun that I felt would have any kind of a cross-jurisdictional coordination applicable in federal law enforcement. And although I think I just did actually realize that I left off the Washington State Patrol, but that can be fixed.
I don't think it was in there.
Yes, so I would amend it to add the Washington State Patrol. I think that'd be important. But it does have federal and our local.
Thank you. Any discussion about the letter from board members? I did, in reviewing the letter, suggest a couple of changes I had sent. And one of them was, I kind of added a little bit that described specifically things like, no water for hand washing, no restaurants, no restroom available, things like that. What I left off, I think, was, not heating the food. Food was nothing there to heat the food that was being served. So that's one thing that may or may not be relative, because if you're talking to people working in public health, are already aware of these things. So I just made that a little more clear. We can add or not add it, they're relative. I'll let that maybe.
And just as importantly, it's lack of cold holding.
Yeah.
Equipment to keep the meat refrigerated.
So I had sent that to Victoria, so if we want to include that, if we think it's important to include those factors, we can just put it in one of the dotted things on that.
I will say too, on that note, then, if we're going to add a dot about food handling specifically, I was leaving an event for the museum on Saturday evening downtown, and actually right on Fifth was one of these pop-ups, and they actually had the meat on and just an open, like, flame, just, wow. And I happened to be with Lieutenant Wisner at the time from YPD, and he said, oh yeah, look at that, we can't, it's whack-a-mole with these guys. So you know, it really is so prevalent that even, you know, YPD just can't even, it's just, yeah, we gotta get it fixed.
I had a chance to look at the letter, and I liked the approach. Is it possible to post or put it on?
I have printed copies.
I think for the public consumption, since
Yeah.
it's a public document, that would be good to have it up on the screen.
Yeah.
Do you want me to, screen share? Okay.
Yeah, I just wondered if that was possible. I liked the letter. I liked it. Just thought it'd be nice to be able to show it.
I like the letter too. It's very well written. The only thought that I had occur to me is like anytime you're sending this letter to all the masses, right? You want to quantify just how big of a problem is. And we don't specify that, you know, we estimate that there are 150 vendors in Yakima County that are illegally, I mean, we don't quantify it, right? We talk about.
Provide that information. I don't know if feel like you have confidence in how many that you, I'm not opposed to that, but I did not want to seem like I was exaggerating the issue without being able to quantify it.
Because if you read it, I mean, during one of the days, we talk about 5 to 8 vendors, and if you're a federal official, like 5 to 8, that's, but when if we can comfortably say 150, or you mean, to me, that's more alarming, so.
It's hard to quantify. We'll catch them, they'll change their name and come back under a different name, they'll switch individuals out under the same name. It's really hard, and if they're all linked together or not. And since there were 3 specifically that we were contacting quite regularly, and they're kind of the originals that broke ground here in Yakima County. Once they began getting hostile and aggressive with staff, you know, we decided that we need to have law enforcement working with us to address it. So it's been it's been hard to make contact with everyone that we see because it's,
I think, yeah, Alicia says maybe state the frequency of encounters rather than numbers. That's probably a good compromise.
yeah, and I mean, I'd probably be able to, you know, do a little drive around one evening and start counting them. It's not beyond.
Well, I think.
It's a big county.
Around sooner rather than later. So
Yeah.
I would just say that I'm certainly not opposed to adding a bullet point that talks about improper heating and cooling. And
All those little items that
yeah.
one's top, all those items.
But it's really critical, we all know this from writing letters, you don't want it to be too long, you're trying to get it
Yeah.
beyond one page, I don't want it to be, you know, so I would say, yeah, maybe add the bullet point, and then Shawn, defer to you if you wanna let me know if there's a.
I can reach out to, like Sunnyside, for example, their code enforcement officer has been, engaged with us on this issue and he keeps pretty good tabs on what's going on, so he might be able to give you an estimate.
Would you wanna say, I mean, it's something that is encountered on a weekly basis within the county?
Daily.
We could,
Daily.
we could not only say
Okay,
it,
I think that's good enough, if we could say this is encountered daily in Yakima County.
Yes.
that
With
it's-
several sites daily.
yes.
Yeah,
definitely. That's
in
very
several
easy to do.
cities.
Several sites across the county daily.
Yeah.
You also.
Are we good with that? Okay.
And it's been an explosion of locations.
Yeah.
It started in a small,
I'm sure the ATF wants to hear that word.
well, proliferation.
That catches their attention.
I think since your audience is mostly on the list there, law enforcement, I'm not saying that, you know, getting into the details of the public health.
That's why I left it out, honestly, is because.
But I mean, I understand your point, and then I would say, know your audience, so.
That was actually the reason why I didn't list it. I didn't want to go into well, it didn't bother you, the temperature. These folks are concerned about the criminality aspect of it.
Well, we could leave it off. Those are just thoughts I had. There's no particular issue there. Because I think if you're working with a state board of health, working with these people, they're very aware of what.
Yeah,
of what
yeah.
So just for the intent of the letter being shorter and more succinct, like you said, Commissioner, I think we're fine leaving it on. Except that I would like to talk about, make a statement about daily across multiple cities in the county.
Yeah.
I will add,
I think you're just your first bullet point there. I mean, you just add it towards the end of that bullet point. Yakima Health District began making contact with unlicensed vendors back in February 2025 on a daily basis.
well, and this continues across the county on several sites daily.
Yeah.
Yeah.
All right, we can do that.
The only other, the only other comment I had, and this is just a consideration, I had some feedback that we might use more, what people would consider more appropriate language other than illegal aliens, we might say undocumented workers. I'll leave it to the board to decide how they feel about that.
My preference is always to use the words that actually describe the thing you're trying to describe.
I would share though that I can speak as the executive director here. Our mandate, our authority is health only, and this is being sent as a Board of Health letter. I want to share that we have heard from law enforcement about the criminality. We've heard about it being multi-state, but that's not in our jurisdiction. And it's also not something that we have had verified in terms of a legal interaction. So the concern around the term illegal alien is that it can alienate members of our community who are already very, very apprehensive about the issues that are happening around immigration in this country. I like the idea of trying to address this issue. I like the idea of people being licensed. I certainly don't want anyone to be taken advantage of. And we have heard that there is concerns around trafficking, which is a tremendously concerning issue. At the same time, though, I do want to recognize that members of our community are very apprehensive around this, and I don't want them to feel further fear in our community. It's a tough time for people, and people feel under threat. And those are members of our community who are not only undocumented, but those who are here and have been born here, and the children of people who may have come from someplace else but were born here feel fear. So I really want and encourage the board to recognize that the words we use matter and the tone we use matters we want a result that is about safety and meeting the integrity of law, but not at the result of causing fear.
I think it's fair to say that we've drawn a conclusion that this is something that expanded, I'm gonna use your word, exploded.
100%.
When we saw over 14 million people illegally come into our country across our porous border. So it does not seem natural to me to cite the source without calling out that the direct source of it is the people who are capitalizing on the influx of humanity that came across our border illegally. It is simply a fact that over 14 million people were led into our country illegally, and there are consequences to public safety and public health that citizens are experiencing and those who are already in the country illegally. And this is needed in order to address those issues.
You back from the board?
I guess is the discussion, or is someone making a recommendation or a motion to replace illegal aliens with a different word? Is that what we're
Just
just?
a discussion.
Hearing none, I move to sign the letter as written. There's a second.
I'm sorry, I was
With the amendments, with
With the adding of the sites.
yeah.
Any further comments or discussion?
Again, I think it was very well written. I think to Commissioner McKinney's point, we have to know who our audience is, and there's a lot of law folks copied on it. So I mean, in regards to the language, I think when I read it, at the end of the day, you tie it into the untold dangerous criminals into our community, and that's really what this letter is targeting. So.
Right.
Have we moved for, are we taking the vote?
Well, if there's a motion, put the letter forward with the added amendment of clarifying the amount that takes place, whatever that bullet point says, that we would move forward. All those in favor, please say aye.
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 Any opposed? All right, thank you, board. We'll move forward.
Oh, may I share one thing, if you don't mind? Again, this is a letter coming from the board, so I want to respect that it's coming from the board. But when we talk about our audience, we also make sure that our audience includes people who again are apprehensive about these issues and feel unsupported. So I want to just encourage us also to recognize that the actions that we take, and certainly the actions of the board, which is totally appropriate and is the board's privilege to do so, has impacts on our community. There really are people who are on edge and fearful, and that's being impacted in terms of public health and others, like people not going to see physicians or not going to the hospital when they're sick. We're not accepting social service outreach because they're apprehensive that something's going to happen. And these are not just people who are undocumented, these are people who are living here legally, who were born here, but look and have a complexion that causes them concern about enforcement issues. So it is a pressing issue, and I just wanted to share with you candidly that that's something that I'll bring up because it does impact a broad audience of people that we serve. Thank you.
The other question that came to mind to me was to sign the letters, ordinarily as the chair would sign the letter. Do we want the chair to sign the letter? Do we want the entire board to say this is from the Board of Health? How do we want to do that?
I think at minimum, the Board of Health. I would love to have my signature attached to it, so I'm not opposed to providing my signature.
Yeah, in the past, it's been the chair on behalf of the board. That's what we've done. The board chair sign it.
If, in my opinion, it looks more powerful when you have 8 signatures on it versus 1, but.
We could
Replace the Board of Health and everyone can sign.
Well, it is a letter from the Board of Health.
Yeah.
I think that's what we're trying to drive home. And if I could just address Andre's point there, I think your point is well taken, because I from personal experience, I know that, 2 lives ago, I was a farmer. And we had, a number of employees who, nearly all Latino, and typically I would learn, we'd always get documents from them. And typically I'd find out if they were appropriate or not, if somebody got pulled over and got a DUI or something like that, and they got sent back home. That having been said, over the years, I found that we've had there are a number of people that actually work in the valley who don't have proper documents. They did cross the border illegally, but aside from what they did, I mean, it happened because we had a decades-long practice of, we had a long, expensive bureaucratic immigration system from a legal standpoint. We had people that were starving or needing jobs or fleeing political persecution, what have you. And we needed them to be here to harvest our crops and help our economy. And so I understand where you're coming from on that, Andre. I do think, though, as we look at this letter, though, the focus is a criminal enterprise, and that's really the focus of what we're trying to, to get after.
Yeah, my comment would be, it's unfortunate that we even need to send this letter, that we even needed to write this letter, that we even needed to consider this issue, because it kind of is silly and crazy to think that we just have vendors popping up all over the county, all over the place. I saw the same vendor 2 nights in a row, Commissioner McKinney mentioned, and that our hands are kind of tied, and so is our law enforcement. And so it's kind of like, well, what do we do, right? And it's unfortunate, but I think it's necessary, unfortunately. So thank you for taking the initiative to write the letter, and yeah, I guess we move forward.
Yeah, I don't think we could, yeah, I mean, we've got people's lives that, are being at risk due to the activities here, and we can't just ignore it.
Oh, and in fairness, I should share, to the Commissioner McKinney's point a few meetings ago about vaccine hesitancy and our interest in communicating to people. We also wish to communicate not only to the public, but to those vendors who are licensed and are working very hard, that we understand that this is a concern. And we want people to be very clear that frequenting places that are going to be healthy for them, that are also licensed, that are paying taxes, that are doing everything correctly, are the people that should be supported. So that's part of our responsibility. This is a group of hardworking folks. There's a lot of mom and pop restaurants in this community where people are living the American dream, and they've worked hard to earn it, and we want them to succeed. And the reality is that anytime someone not only eats at a place that's unlicensed, they're putting their health at risk, but they're also taking money out of the pockets of people who deserve that support and deserve to be able to pay their bills. And that bothers me as well. So this is part of a larger issue. And frankly, Yakima is one of the counties that's leading this initiative. So I'm grateful to the board for your willingness to have this conversation, because it's largely not moving forward at the pace that we feel it should in the state.
And we can't forget that the health district staff did their due diligence with trying to educate and bring people into compliance. Probably more than once, I would assume.
A lot.
Many, many times.
At night, it's a lot at night.
I've received emails into the city from a couple of the owners of mom and pop businesses who have done everything, by certification and by law. And when I hear that the illegal stands make $7,000 a night in some cases, that's money taken away from rightful businesses in the community. So it does jeopardize.
I think this is another example, and it's a microcosm of the fact that these people are here. They're here illegally. They don't have the ability to work within legal constraints. So they're going to always find a way. And as long as they're still here, they will always try to find a way to make money so that they can do the things they want to do. It's never going to go away until the people who are here illegally are removed. And it is unfortunate, Andre, that there are people who are living in our community who are fearful. Whether or not they should be or not is certainly a personal subjective opinion. But the reality is we would not have ICE enforcement receiving so much coverage if we didn't have over 14 million people come over the course of 4 years into our country. We would not have the need to go after these people to remove them. And because they are here illegally, they cannot operate within our system. And so you will continue to see law-abiding citizens get the short end of the stick. What we get for it is more crime, more violent crime, more drugs, more deaths from fentanyl, all of those things, while the people who are here illegally causing those issues are also taking money out of the pockets of the citizens who are paying taxes to fund law enforcement who's going after them, or the public health servants who are trying to go after them. It is a vicious cycle, and it will only worsen if we do not address it.
Alicia, you have your hand up?
Yes, thank you, Madam Chairperson. Question, is it outlandish? Is it too big of a task to be able to dedicate a tab on the health district's website to post who are legally there and maybe do an advertising campaign to say, hey, we want to make sure that we're keeping you safe, Yakima, make sure that you are only using licensed pop-ups, you know, and again, asking them to ask for, to see their license, to look for water, to things to look for. Do we do an education campaign? Because it's probably going to take some time, as referenced earlier. We're going to send the letter out to government, but are we going to get a quick response? No. So what do we do in the meantime? Do we jump on and we do something at a local level for local prevention and educate the community?
Alicia, we just discussed that at length yesterday. So that's part of our process, and we can give the board an update at the next meeting.
But to that point, in the, how do I say this? I mean, at the end of the day, it's criminal activity, enterprises of human trafficking and that type of dialogue. So are we planning to share that into the community that, hey, you know, these are bad actors. Not only are they not in compliance with the health district, but they are potentially human trafficking individuals, because that is a different tone and
You're
message.
funding human trafficking by going to these food vendors.
But are we prepared for the health district to have that type of messaging, right? Because that's different than just saying, hey, look for the food certificate that's supposed to be at the corner of the
I
cart.
think that's way out of our mandated authority. And I share that, and I really share that. And I've had conversations with chiefs of police who have talked about trafficking, and it's heartbreaking. And I want to help address that. But in terms of our authority, we don't have that authority. And no one has shown me anything, and nor do I have the privilege to see it because I'm not in law enforcement. That issue is something that, again, I don't doubt that that's happening, and I don't doubt that it's a concern. And I think that people are doing things that are part of an enterprise that, as Commissioner McKinney has said, is trying to skirt the law, but that's not something that I can prove. And I think that us having that conversation only, again, enhances miscommunication about what our mission and mandate is right now.
I do think, Commissioner Curtis, that it would be something that would be more appropriately done from the sheriff's office and with our police chiefs. But I do agree that there should be, to Alicia's point as well, something forward-facing that says, hey, we're seeing a lot of these out there. Make sure that if you're doing it, you are looking for the food safety handlers. What do we call it? A license certificate? What the term is?
Permit.
Yeah, permit. Thank you. Because you certainly are running a risk of obtaining food poisoning or
I
something.
think that the primary message is to protect your health and your family's health and be aware of this and list all of those things. That would be within the scope of the health district.
I think we have a comment from Alicia. Alicia, did you want to say something, or did you just write that in?
Oh, I just typed, I said, I agree, Andre. I think that is outside our scope to handle that. And just in a roundabout way, we're discouraging supporting the unsafe, unpermitted, those that are trying to skirt the system, vendors. But I think in addition to the permitting, because as Commissioner McKinney can attest to with our banking background, they will start to create fake ones, right? And as good as you can create fake ones, they will post those. So we need to encourage them to look for other things, running water, bathroom facilities, wearing gloves, you know, like these are the things to look for.
Yes, and thank you, Alicia. And if I may, I wanted to also share that what we're running across is a complicated issue for law enforcement. This is not something that they normally have to deal with. We have been very fortunate in this valley that this is almost non-existent until recently. It's not something that's been addressed, but also asking law enforcement to move into issues around code violations regarding food or being unlicensed is a totally new area. And also, in fairness, law enforcement has a great deal on their plates already. So part of our catalyst model, as we've tried to deploy here, is how can we support our partners in serving a mission that's both complementary to public health and complementary to their responsibilities. So that's something that I'd like to bring to the board's attention. Again, it's not fair for me to ask law enforcement to do more than what's being asked of them already without some clear support, because it's not possible.
A question. So, on the reservation, like our tribal school, they have fundraisers and they do like an Indian taco feed. How do we put the message out there? Okay, if you're going to do just like a one-time unpermitted food for fundraising purposes, what does that process look like? Like a lemonade stand even.
We don't talk about lemonade stands.
They
shall not be named.
In the blink when I pass those.
Yeah.
So fundraising, oh man, this always comes up just often enough that I forget what the technical requirements are when it's fundraising, but it has to be attached to some sort of charitable organization. Boosters doing fundraisers for school athletics and stuff, they're not exempt from permit, so unless it's an exempt food product, so commercially prepackaged is about the only route, unless you're tied to a charitable organization. I will say though, on the topic of putting out information around, how to identify if a food establishment is safe, or unlicensed or licensed. Kate, just reminded me that the State Department of Health for the month of September, is, doing for us Food Safety Month, a special campaign that's going to be, putting out educational material around this very issue. So unlicensed, food vendors, what to do, how to identify, and things that you can recognize to ensure that you're eating at a safe establishment.
Have you gone to Toppenish in that one section on Sunday?
Yeah.
And they have like.
I haven't, my staff has.
Multiple, probably unpermitted.
Yeah, oh, yeah, and that's an ongoing one. Even the railroad company there, it's having a hard time keeping them out of there, so it's
But they're paying their taxes, right?
Sure.
I just wanted to, I'm sorry, go ahead.
Oh, but, and so there is some information coming. I think Lilian, you may have.
Yeah, so earlier when I referenced supporting the environmental health department, this is actually one of those initiatives that we will be supporting. We've been keeping an eye on what other counties are doing, because this isn't our issue alone. But yes, that is the plan, is to do a whole comprehensive campaign to make sure that we can, one, make sure that the community is aware of what to look for. I'm learning a lot as well, because you really don't think about, oh, let me make sure that I see, a place where they're washing their hands. You just kind of show up and you eat. So trying to make it as accessible as possible so that people have the information available, but also wanting to stay in line with some of the statewide messaging that's happening. So we will be tapping in, so to speak, to help with that.
I just want to address one thing too, going back to the language that we're using. This letter is very intentional and it's very specific, and it is focused on some illegal behavior that is cross-jurisdictional, which could bring in federal assistance in that. And I think because of that, the use of the language will, that's one of the things that they look for, is language that will draw their attention. What we're saying is we have a cross-jurisdictional issue here that we need help with, so. Because I know that there's federal agencies on the list that we're sending the letter to. Any further comments? All right, thank you, board. We'll move on to 8B, which is selection of a local health officer. And it is open for discussion.
To begin discussion, I would, Madam Chairman, like to propose that the board appoints Dr. Dave Atteberry to the position of Public Health Officer for the Yakima Health District.
Second.
Okay, so we have a motion and a second for the board to appoint Dr. Dave Atteberry as the health officer.
May I speak to my motion?
You may, please.
I just wanted to thank the board and staff for providing a lot of good conversation and background of information. I will just say that Dr. Atteberry, we've had the pleasure of having you serve as a peer board member. We've also really enjoyed watching you serve as interim. I think that you have proven to be someone who takes this role very seriously. I think that your information is relevant. And I believe that you will continue to serve the community very well. I'm actually very glad that you would like to serve the community in this capacity. It was something that I felt long ago was very important that we have a health officer who is indeed living in the community. It's just a lot different, I think, when you're able to really see and feel and touch what's going on and understand the impacts of the decisions that you may make in your role. So I'm speaking in a high confidence for your official appointment to be our permanent health officer.
Well, since I second it, I'm just gonna add on to it. I've known Dr. Atteberry for a number of years, as we worked previously at Sunnyside Hospital, but you know, and had a good relationship there and appreciated the work he did. But really, what I'm really pleased with what I've seen you do as an interim health officer. I appreciated your reports. I think they've been very thorough. You've looked for all the information. You tell us what you know. You tell us what you don't know. You give all sides of the argument. You're not coming with an agenda. You're just here to lay out the facts for us. And I appreciate that. And I think that's exactly what we need.
I will say the same. I've appreciated very much your responsiveness to issues raised by the board or questions that come up, that you're very actively, immediately engaged in the process of getting information to the board. That's great. Any other comments?
Well, if I may make a comment, I would just simply say that I have a deep amount of gratitude for Melissa Sixberry and her staff and all of the people that work for the Public Health, Yakima Health District, because everything that I've done in this role, I've done leaning on my partners who have greatly helped me, and they're giving me the world's most rapid education in all aspects of public health. So, including learning a new EHR, which for anybody who knows me knows how much I hate electronic health records. And I'm like, oh my God, another one. So anyways, with that said, I appreciate your support, and I had a chance last month with Melissa to go to a TB meeting with world's experts really on TB. And I remember I raised my hand because they were talking about a specific aspect of TB and Pott's disease, which is a spine disease you can get from TB. And when I answered the questions with regard to the stability of the spine and its alignment in how the case would turn out, the guy looked at me and said, wow, that's quite a detailed explanation. And then I told him, well, I'm a spine surgeon. And so he was taken aback like tenfold by that. He was like, wow, and you're here. And so, yes, I very much enjoy learning new things and taking part. And I do take the job very seriously. This role is crucial to the public health of Yakima County. And so I will do my very best for as long as I serve you to do the best job I can and to lean on my partners and continue to learn from them and learn about different aspects of public health.
Thank you. All right, any other discussion before we take a vote? Seeing none, all of those in favor, please say aye.
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 Do we have any opposed? All right, motion passes. Congratulations, Dr. Atteberry, and congratulations to the board. It's an excellent decision. All right. Next is
Congratulations.
is the selection of, I know we just said that, let me get down here. New business is new citizen representative and reserve health officer. So with Dr. Atteberry stepping into a position of permanent health officer, that opens up the position for reserve health officer. And also, you'll be off the board as a board member.
Right, I'll take this opportunity to resign my position from the board. And obviously we were anticipating if this were to take place, at that point I would resign. So thank you, Mrs. Byers, that I get the opportunity to do that. And I appreciate all the time I've spent now, 4.5 years. I guess I've been on the Board of Health and learned, boy, even a more tremendous amount about various subjects while I've been here. So I would tell anybody that takes this role, to say it's an education, and yet it's a wonderful experience to learn and to see what a vital role we play in the public's health here in Yakima County. And I think this is, and I've said this before, the best health district in America, for that matter, much less Washington State. So
It's a gold standard.
it is the gold standard. We certainly pioneer a lot of things here in this particular venue. So I would say whoever takes this position, just realize it is the best thing you can do as a citizen to play a role in the taking a part in this organization.
Kind words. Dr. Atteberry served us well in his time, not only as a board member, but as an interim health officer. He's really done a great job. As a reserve health officer, he was a pleasure to work with. But in terms of the interim work, he's been wonderful to work with. And we don't anticipate anything less in the permanent role. Although Ryan will explain, you don't have to necessarily resign yet because we have to go through a couple.
Sure, right.
We have to go through it.
Yeah, so we'll draft a contract, which will be in a form of resolution, which the board will approve next meeting, and that's when it will become official. So,
You're not off the hook yet.
Take it back.
As soon as it's appropriate, I will resign.
yes. And then I can go.
Go ahead
how we're
and
gonna move
explain
forward.
what the
Okay,
process is.
so we did talk to our attorney as far as how we move forward with the citizen representative position and reserve health officer. According to the Yakima Health District Board of Health Resolution 2022-01, be it hereby further resolved, if a citizen member is unable to complete their full term, then the Board of Health shall follow all required steps above identified to fill that position. So our attorney says that we do need to go through the process to fill the position of advertising, interviews, and everything for the board position. So that person, it does also state in here by fulfilling the completion of the new member appointed shall serve out the remaining term of the departing member by fulfilling the completion of the departed member's term. The new appointed board member remains eligible to serve 2 consecutive 4-year terms. So Atteberry is 8 months into his second term. So the new board member will serve the rest of this year, 3 more years, plus will be eligible for 2 more terms. So then moving forward, we'll go ahead and, like I said, we'll start advertising for that position. And then however, for the reserve health officer, there is no process in place. So it is up to the board how they want to move forward with the reserve health officer. We don't have to follow any type of recruitment or anything like that. It has not been outlined. So it's up to the board now to how they want to move forward with reserve health.
Thank you, Mr. Harwood.
Just curious on the resolution and the process. I mean, could we decide as a health board now that we're going to post the application for 2 weeks and have an interview committee already ready to go so that when we meet in September, there is a recommendation before us that this board can take so that we actually get someone on this board by October
Yep.
versus if we wait to look at candidates in September, then get an interview committee. I mean, we'll be in December before,
Yeah, 2 or 3 months. So I'd like to shorten the process as well.
if that is an option for us.
Well, it's different than employment. So and thank you, by the way, it is an unpaid position for those who are unaware, but we're grateful for your service, but I think that that's probably possible.
Ryan, does it call out how long we have to
Yeah,
have? Yes,
I was just looking, I was thinking it was 30 days.
I was thinking the same.
It's 30 days and it's a moot point, right?
Nice try, Commissioner.
I think the rationale in creating that section of the bylaws was that you want to give the community sufficient time to advertise so that, you get a robust result.
Correct.
How soon can we get an ad out?
Well, while Ryan's reading that quickly, no pressure. We also have another issue for the board to consider, and that is, as Ryan mentioned, we talked to Chris, and Chris said that the board has the privilege to appoint at will a reserve health officer. What we ended up with, because Dr. Atteberry was a board member, we ended up with a reserve health officer who was also a board member. That's the board's choice. The board does not have to choose to do that. So the board could make an appointment for the reserve health officer. The board could wait. We can give some backstory on that, but
So for the Board of Health position, interested candidates submit letters and qualifications and interest to the Yakima Health District within 30 days of the announcement that the position is vacant. So within 30 days.
If we're giving them 30 days, that insinuates that we have to hold it open.
So if we hold it open, how long do you think they can ad out?
So what we'd be able to do is we'd advertise immediately, and then we would provide the list of candidates to the board and they can decide how to move forward. You know, if we want to interview all the candidates or narrow down to, you know, 3 or 4, how many we want to interview.
That means we have to wait till October? Or could
Sep-
we vote
September,
on it at the September meeting? If we
yeah,
have
on who,
applicants?
yeah.
Thank you.
Yep, and if there are multiple applicants, we'll interview and then it'd be October.
Can we interview candidates in the process while waiting for those to come in?
You could, but you'd end up with multiple interviews,
Yeah.
which actually could be longer for you.
And you might not have the same people doing the interviews, which is usually not desired.
I think we follow the process.
Yep.
Standard process.
Yep.
It's there for a reason.
Sorry.
But if
That's the Board of Health.
Good try.
At the September meeting, you can start to subject names and you can appoint an interview committee and open up interviews for the very first part.
Yep. But then now we need to discuss how we want to move forward with the reserve health
Right,
officer.
okay, so we have the issue of the reserve health officer, which we as a board can, there's no regulation on that, we can immediately appoint a reserve health officer.
So point of information, is there a candidate that's interested in the reserve?
So actually, yes, so Dr. Maxwell did apply for the health officer position. She did withdraw her name, but she does have interest in the reserve health officer. And she did, we did interview her on July 10th, 2024, so a little over a year ago for the reserve health officer position.
I would make a motion to nominate Dr. Maxwell as the potential reserve health officer.
I'll second that.
I'm not opposed. I would just say that I do believe it's important that we repost because there is a difference when people are deciding what they want to apply for between the health officer and the reserve health officer as far as functions and time commitment. So while we might end up with the same result, I do think it's important that we at least go out to the public to see if there's anyone who's interested in serving in the reserve health officer.
If I could, I would just say that I've watched Dr. Maxwell over the last couple of years and she's been a regular attendee and shows an interest in public health. I know she has a master's in public health and so, with all that in mind, I don't know if we're gonna have applicants come out of the woodwork. But I do appreciate the fact that she's, been here, been engaged, been interested and has the necessary background. So.
I'm going to agree with that in that Dr. Maxwell has been here on a consistent basis. She showed the interest. We certainly know from her previous interview that she has the education, the ability, available in the community, all of the things that are really critical to us. I don't remember, Dr. Atteberry, when you became reserve, was there like a?
Face to that, I don't believe so. I think it was just,
It was appointed.
it was, Dr. Barg and I both applied for the health officer position. And then when Dr. Barg was appointed the health officer, then I became the default reserve.
And we
health officer.
appointed
And you
you.
guys appointed me, and so that was how it was done then. And I would say, I think that to Commissioner McKinney's point, I think that if there were a member of our medical community that was so interested as to be putting themselves out there and interested in this particular position, they certainly have had ample time over the last year or so to make that known. Certainly Dr. Maxwell has made that known, and knowing her through the interview process and reading through what we know about her and her background, I think that she played an excellent role in that position. So I would support appointing her, and if we can't appoint her immediately, I would support appointing her as interim reserve health officer until such time that she could be appointed immediately. So I guess whatever would make that follow Robin's rules.
I would speak in favor of that idea. I think she's quite exceptional. I have no opposition whatsoever. My only reservation is not doing the process to say that we are representing to the committee. So is there an option to appoint her as interim and advertise? And if no one else applies within 30 days, then the board could move at that point to.
Interim reserve health officer.
Mhm.
That's quite the title.
It's gonna start needing a line on the card, you're getting a lot of words.
So Alicia, you have a comment on that? Alicia?
I just said if Dr. Maxwell's medically qualified, I'm comfortable in moving forward with her. To your point, Madam Chairperson, and to Commissioner Lindy's she's been regularly attending, she's showing a commitment, she's engaged. I'm comfortable with moving forward.
Thank you. So we have a motion on the floor, and the motion is to appoint Dr. Maxwell to the Reserve Health Officer. So we either need to act on that motion or to amend the motion, and that would be up to you if you would amend or if you want to. Or we
I
can-
second the motion.
I would only, say that, from a procedure standpoint, Commissioner McKinney's point
I
of
can
whether
offer
or
a
not-
friendly amendment, but I haven't, I mean, if, I'm absolutely willing to go with consensus on this one. So if I'm the only one who feels that it's important to at least go out to the public, I am willing to concede that I'm the only one that thinks it's important to go out to the public. Because I definitely don't want to appear as though I am in any way opposing the appointment.
If I can add a point of clarification, in discussion with Chris Mertens, there's nothing in state law that discusses a reserve health officer. So there's nothing precluding moving forward. Your point is well taken about the appearance and opportunity, but there's nothing that we are having to follow. The reason we have a reserve health officer was because at the time there were regional health officers that would have been considered backup. The board decided they wanted someone local. We created the reserve health officer position to act as that fail-safe in a sense. So Chris has advised us that the board can move at their pace.
Well, I think acting under the assumption that Dr. Atteberry would appreciate having some form of backup. I would like to call the question.
Thank you. So the question's been called. Is the board in agreement with the question being called? That would end discussion. All right, thank you. We'll move forward. The motion is that Dr. Maxwell be appointed Reserve Health Officer. All of those in favor, please say aye. Aye. Any opposed? Motion passes. Thank you. Thank you, Commissioner. Yes, congratulations, Dr. Maxwell.
Thank you.
All right. Then we move on to other business. Does anyone on the board have other business today? Hearing none, I would entertain a motion to adjourn.
Second.
So we have motion and second to adjourn to the next Board of Health meeting on September 24th, 2024. All of those in favor, please say aye.
Aye.
Thank you. Then we are adjourned. Thank you. Great work today, board. Great discussion. Who do I want to work with?